Good morning, everyone. This is Sheila Mott with the Agency for Persons with Disabilities. We are glad to have everyone here with us this morning for this informational overview regarding APD iConnect. But before we get started, the director would like to go ahead and start with some opening words. Director, go ahead, please.
Well, good morning. And Sheila, thank you so much for all of the hard work that you and the other trainers do. We really appreciate that. But I just wanted to open it up and say to all of you, I know there are quite a few providers on this webinar, that we are just very excited about where we're going. And I know that there are a lot of questions that people have, and today you're going to get a lot of answers. And we're just excited to finally be able to roll this out and get you some information. I know a lot of people have been asking, and so today's the day. And you all have a good day, and onward and upward. Thank you so much, Sheila. We really appreciate you.
Thank you, Director. Excuse me. I see from the chat box that a couple of folks are saying they're having difficulty hearing and getting some feedback. I think that might be on your end. The sound check that we did earlier seemed to be working. So I do apologize if you're having difficulty. Before we dive right in, just a couple of things. Some of you have already found it. There is a question or a chat box that you should be able to see. Please type your questions into there. If we have time at the end of the presentation, we will get to those questions, but if we don't, we'll send out the questions and the responses and or update our FAQs on our website. So just keep sending the questions in. And then the other thing, couple of other things to remind you before we get started is one, this presentation is being recorded and it will either be posted on our website or it will be posted through our GoToWebinar platform as kind of an on-demand presentation. It is a presentation, not a training. Today's goal is just to give you an informational overview of APD iConnect and what it means for providers. Our support coordinators have been working with APD iConnect, but we recognize that for our APD MedWaiver providers that a lot of this information is new for you. So that's what we're going to do today. We're going to just give you a little bit of an update on where we are today and how we got here, and then talk about what this means for you as providers. As many of you know, we had our successful launch of APD iConnect this past December the 4th, and it was released for support coordinators and APD staff. And that was an exciting day for us because it was the culmination of 3 years of hard work and input from a lot of people. As you know, we've partnered with our vendor WellSky, formerly known as Mediware and Harmony. And together we have worked to create this application that I think a lot of you are going to really appreciate some of the functionalities that are coming with it. But in terms of our launch in December, we just had some initial functionalities, and you'll see as we go through the presentation this morning that the functionalities are coming out in different rollouts because we want to make sure of a couple of things. One, we want to make sure that all of the functionalities work the way they're intended so that when you start using the system, it does what it's supposed to do. The other thing is that it's a lot to learn. And so it makes sense that we roll out certain functionalities at a time and let the users get used to those before adding in the next. So this past winter, what we did is we rolled out the functionalities to be able to allow support coordinators to work within the consumer's record, updating consumer demographic information, which is something that they used to do in ABC, updating contact information for members of the circle of support. Prior to that, there was never really a centralized location for that information. For you as providers, you might have contact information. The support coordinator might have contact information, but it may not always be the same because maybe that relative let you know that they got a new phone number, but they didn't let the support coordinator. Now all that information is going to be stored in one location. Support coordinators have also been able to add and update medication information so that we've got a current and accurate list of medications for the consumers. And then the other functionality that we rolled out last December was the completion of the HCBS waiver eligibility worksheet from directly within the consumer's record. As I mentioned earlier, we are doing a rolling implementation schedule with APDiConnect. And so what we're looking at is, over the next couple of slides, what our projected rollout schedule looks like. Again, the rollouts are targeted dates based upon what we know today. We are still testing functionalities, and so if there's something that still needs to be tested and refined, it may impact the schedule. So please look at this as just a high-level overview projection as of today. So rollout 2 is scheduled for the fall of this year. And again, our users is going to be APD staff and WSCs. We're just going to add some functionalities to the things that they'll be doing. That will include things like completing and generating the person-centered support plan and the AIM from directly within the consumer's record. And then we're also going to be transitioning what we refer to as some of our financial functionalities. And this is an area where there will be a change in terminology. One of the things with APDiConnect is that not only is there a change in how we do things now compared to how we're going to be doing it, but also some change in terminology. So what we currently refer to as the cost plan or the service plans in iBudget, as we transition that functionality into APDiConnect, you'll hear things like plans and plan services. Very similar functionality, just different terminology. And then from the plans and plan services, we will be able to create authorizations from directly within APDiConnect. What does that mean for you as providers? That means that once rollout 2 happens, instead of getting authorizations from the support coordinators that were generated by iBudget, you will get authorizations from support coordinators that are generated by APDiConnect. What you're going to love in the future is that once you come into APDiConnect, you'll be able to get those authorizations on your own. They will show up in your provider record, and I'm going to show you that in a few minutes. Other functionalities that are scheduled for rollout number 2 include support coordinators starting to do their progress notes in the consumer's record in APDiConnect, and we will be transitioning the significant additional needs process or the SANS process over into APDiConnect. Rollout 3 is scheduled for early 2020, and that's when support coordinators will begin transitioning their claim processing from the FEMAS portal into APDiConnect. And then the rollout that really matters to the bulk of you that are on the call this morning is rollout 4, which is scheduled at this point for spring of 2020. That is when our wave 1 of providers will start their transition into APDiConnect. We are doing, again, that rolling implementation for our providers, and we have several different waves that we are doing. We'll talk a little bit more about this in the next couple of slides, but just to clarify, the waves are defined by procedure codes, and that is something that is being coordinated with ACA because it does impact the FEMAS portal. So we'll talk more about that, but just know that the waves are based upon procedure codes. Rollout 5, which is scheduled for late spring, early next summer, is when that wave 1 of providers will begin processing their claims in APDiConnect. And then rollout 6 will be the phase 1 of EVV processing, which is electronic visit verification. And we'll talk a little bit more about that in a minute. Rollout 7 and all subsequent rollouts is when we will start bringing in the additional waves of providers, the additional phases of EVV, and then finally we will have the consumer caregiver portal. And what that is, just so you're aware, think about it with even your doctor's office. Many doctor's offices now have this portal where you can log in and get the results of your last test or see the doctor's progress notes from your physical when you went in this year. It will be similar to that, where you're not actually logging into the record the way that the support coordinator or the provider sees it, but as a consumer or a legal representative, I'll be able to go in and get certain elements of information, like the person-centered support plan, for example. but that's scheduled far out into the future. Our projected rollout schedule right now only goes up to the winter of 2020. And again, a lot of the things that impact all of our rollout dates are the testing of the new functionalities and if there's any remediation that needs to occur from a previous rollout. So those are the things that affect our schedule, and our APD iConnect team at State Office, they work diligently together every week just analyzing where we are with everything to make sure that we're getting up to our targets, and if we need to adjust our targets, we're making that adjustment appropriately. But let's talk a minute about what happens when you do get to transition to APD iConnect. This will be the same for all waves, but we'll just focus on wave one of the providers. For each wave, as you come into APD iConnect, what you will be doing is learning how to manage your own provider record. So think about how life is for you now. When you first applied to become a MedWaiver provider, or you first applied to become a licensed home, you submitted an application in paper, and the staff at your regional office started a big file. For if you've been in business for many years, there's probably several volumes at your regional office in a file cabinet. That is all going to transition to your electronic provider record in APD iConnect. Now, what's already in paper in the regional office is going to stay there, but moving forward, everything will be electronic. So if it's time for you to renew your MedWaiver services agreement and you are part of Wave 1, you will be doing that within your record in APD iConnect. Or if it's time to renew the license on your group home and you're in APD iConnect, you will do that whole process within your record in APD iConnect. So as you transition into APD iConnect as providers, we're going to spend some time just helping you learn how to navigate your own provider record and how to complete all the steps to maintain that record. The other thing that you'll be spending a lot of time learning when you first start working in APD iConnect is how to enter documentation in consumer records. Provider documentation and claims are very closely linked in APD iConnect, so we will want to make sure that you're comfortable with getting that documentation into the record. Other functionalities that will be part of the Wave 1 of providers is incident management will transition. Right now, you may be sending emails with the Word document to the incident email address in your region whenever there's a reportable or a critical incident. You'll have the ability to actually create those incident report forms directly in APD iConnect, and our incident management team in the regions will be able to access that information and communicate with you more efficiently and effectively. Our staff will also start using some of the forms that are available, it's particularly our licensing and monitoring and provider enrollment forms. Now, keep in mind that Wave 1 of the providers may not include licensed group homes. So the provider, as a provider, you may not be in APD iConnect to receive those documents, but it gives our staff time to start working with those forms and getting comfortable with that workflow so that by the time that those services are brought into and that wave of providers does come into APD iConnect, they'll be more readily able to explain things as you're learning that part of the process. And then, of course, provider enrollment and expansion applications will be going live when we have Wave 1 of providers. So if you are one of those providers in Wave 1 and you wish to add a service, expand to another region, you'll be able to do that from directly within your own provider record, and you'll be able to communicate directly with your provider enrollment specialist or liaison directly from within your record. I know that one of the biggest questions is, how do I know what wave I'm in? When is it my turn? When am I going to get training? Okay, that wasn't just one of the biggest questions, that was several questions. Over these next couple of slides, this is our high-level view of what we're targeting as the procedure code implementation schedule right now. So for example, for our provider Wave 1, as of right now today, and this may change before we get to rollout 4, but right now we're looking at dental services, dietitian, nursing services, skilled respite, and the therapies, and they're all listed here. So if you are a provider of these services, it is likely that you will be included in wave one. As of today, again, please keep in mind this may change depending upon how testing and things go. Our wave two of providers will then bring in the procedure codes that are associated with these services: the behavior services, consumable medical supplies, durable medical equipment, environmental accessibility, and personal emergency response system. And then the provider wave three will bring in all of the other services, which include life skills development, personal supports, residential habilitation, respite, special medical home care, supported living, and transportation services. So again, keep in mind that those services that are identified for each wave as of today, they may change, but this is where our projected implementation schedule is today. So you might be sitting there wondering, well, what if I provide services that she just said are part of wave one, and I have other services that are maybe part of wave three? And we recognize that it's very possible that perhaps you provide nursing services and transportation. It could happen. And so right now, nursing services are showing as being part of provider wave one, and transportation is being shown as part of wave two. One of the things that has been involved in developing the procedure code implementation schedule is that we were really working to try to minimize the potential risk of providers having to work in two systems. And yet the amount of analysis that went through that in terms of trying to look at all of our providers, all of the services that each provider provides, and trying to develop a matrix where we could isolate service providers that only provide these services and no others, that it didn't happen. And so there are some of you that are going to find that you provide services that are slated for wave one and other services that are slated for a later wave. In those cases, it is possible, it's likely that the biggest impact that you will experience is how the claim for reimbursement is submitted. And we'll talk a little bit about the claims, the transitions to claims processing in a few minutes. But again, just know that we are aware that not all of your services, if you provide more than the services that are scheduled for any particular wave, that you may have services that are not what we refer to as live or procedure codes live in APD iConnect. When you do transition to APD iConnect, and I talked about this a moment ago, but just again to highlight what it is that each provider will do as they start working with APD iConnect. You're going to be looking at maintaining your record, and that really is going to be something that will be mostly for our agency owners and our solo providers. Your direct care staff that work for you, they'll not necessarily be in your provider record. Their access is really limited more to the consumer's record, where they're going to document the services that they deliver. Again, you're going to learn how to use the notes to communicate with waiver support coordinators when there's something going on with one of the consumers that you mutually serve. And you'll be learning to communicate with your APD staff just in general in terms of your own provider record management. We also will have some service-specific forms that you'll be able to add. For example, if you provide a service that requires an implementation plan, the implementation plan form is a form that you'll be able to add in that consumer's record. I'm going to show you a little bit about that in a few minutes. But again, I just wanted to highlight where you're going to focus your efforts and your energies when you first start working with APD iConnect. And then, as I mentioned a few minutes ago, as part of our rolling implementation process, providers will come into APD iConnect, they'll work within it for a period of time, and then with a subsequent rollout, they will start their transition to submitting claims within APD iConnect. So what that means is that during those first few months that you're working in APDiConnect, you'll be adding your provider documentation. It may be service logs, it may be transportation logs, it may be progress notes, but you'll be adding all of that documentation in the consumer's record. And then for those services, for those procedure codes that were identified for that wave during a subsequent rollout, you will start submitting your claims directly from within APDiConnect, but only for those. Any procedure code that is scheduled for a subsequent rollout, you'll continue to bill via the FEMAS portal until that procedure code is brought into APDiConnect. And again, that's where the potential is for you to have to work in two systems. You may be billing in two different systems. Let's talk a moment about electronic visit verification, or EVV for short. Um, Electronic visit verification is a federal mandate, and the states are required to comply with this mandate. APD has identified 3 services as the EVV services that we will be using as we launch our efforts to be in compliance with the electronic visit verification requirement. Those services are personal supports, respite, and nursing in non-licensed setting. And we did want to let you know that APDiConnect application itself has a fully functional EVV mobile application, and it comes as no cost to the providers. We acknowledge that there are some providers that currently contract or have purchased another service that may have EVV functionality, and we do want to let you know that at this time, APDiConnect does not interface with any other EVV mobile application. So when we do roll out electronic visit verification, it will be with the APDiConnect EVV mobile application. Training. Think of training as the keys to the castle. You know, this is where you will have the opportunity to be able to learn more about how APDiConnect is structured, what the functionalities are, and all of the things that it can do, because there are some pretty amazing things that we've built into this system. Based upon our rolling implementation schedule, our training also will be on a rolling schedule. So what that means is that when it's time for providers of wave 1, we will offer training for them in the months leading up to their rollout schedule. So if you are not included in wave 1 of the providers, you will not get invited to training until it's time for the wave that you're included in. And I know everybody wants to get in, and if you're like me, you want to get in, you want to click around, you want to see what it does. It's how I learn fastest. It's hard to understand it until you actually touch it and do it. We absolutely get that. But in terms of being able to provide face-to-face, hands-on training with you, we really do need to make sure that, one, you're not getting the training too far in advance, because if there's a lot of time between when you first get your training and when you actually get into APDiConnect as a user, there's a lot that you will have forgotten. It's much more meaningful if you're getting your training right before your rollout. So that's one of the reasons that we need to stagger our training sessions. The other thing is, again, when you just look at the numbers of providers that any particular region has, the ability to provide that direct face-to-face, hands-on training with you is limited by space and the capacity of rooms, those kinds of things. But once you do get your invitation to training, you will be given access to our training site, which I'll be demonstrating here in a few moments. It is a replica of what our actual APDiConnect site looks like, and it will give you the opportunity to have an account and be able to go in and practice things. In fact, if you were a provider prior to our launch in December of last year, we have probably replicated your record as it currently looks right now in APDiConnect. We've replicated it in our training site. So when you come to training, you will most likely going to be able to work within your provider record as it looks in APDiConnect today. So that, I think, will help from a familiarity perspective. You'll be able to look at it in terms of, oh, hey, that's my name. that's my company. Yeah, that's my vendor number. Those things, so that it'll help you kind of recognize the layout of the land, for lack of a better term. And I do acknowledge that there's a little bit of a lag between when I change slides and when you change slides. So I am actually pausing on purpose for this one, because our next topic is the external provider interface. And we've gotten lots of questions over the years that we've been working on the development and configuration of APDiConnect. Some providers currently use their own electronic health record, or EHR system. I know that some folks have purchased a service or their own system from another vendor. Others have created their own system. And so there have been a lot of questions of, I've got this system, it works great for me. Clarent knows what to look for when they come out to do my reviews. Do I have to type everything into APDiConnect, or can I still use my system? We've worked very closely with our vendor, WellSky, to develop what we refer to as an external provider interface. And what that means is that you will be able to import data from your system into APDiConnect. The caveat is that the level of effort will fall to you to ensure that your system can export the data in the way that APDiConnect can receive it. Let me give you an example. And I'm going to pause until the display catches up. The screen that I'm showing you is what a provider documentation screen looks like in APDiConnect. And it's actually on the provider documentation tab in a consumer's record. And this is where, if I were directly entering information into a consumer's record, I would sit down and I would go to this screen. I would, and I know it's a little small, but you might be able to zoom in, but I would be able to go in and put the start date and the start time, end date and the end time. I'm able to link this information to my authorization. And when I grab my authorization ID, it actually fills in all of this other information on this screen for me. So it identifies my provider name, which in this case is Interface Testing Provider. And this authorization 140787 is associated with skilled nursing, registered nursing level. And then down here in the documentation area, I'm able to determine what type of documentation it is. So if I provide a service that requires a service log and a progress note, I can actually click on service log and progress note and bring them both over here to reflect what type of documentation that is. And then I'm able to type in my progress note in this box. So that's what it looks like when I sit down and I go into Johnny's record to enter my provider documentation. However, if you have your own system that you're currently doing that in, then your screen probably looks differently. And again, from the perspective of an external provider interface, you're looking at, well, how do I get it out of my system and into that screen that we had, that I just showed you? And what that means is that your system has to be able to export the same data in an XML file. Now, bear with me on this, because I am not an expert on XML files, but I'm going to go over what I do know. Your data has to include all of these fields that are listed as required. Some of them are match fields, which means when the data comes into APDiConnect, APDiConnect uses that field to match it to the right consumer's record. So for example, we have the submitter ID, which would be your provider ID number that is associated with that provider record, which was Interface Testing Provider. We have case number, which is going to be the consumer's iConnect ID. So that, again, and that's one of those match fields. That's how APDiConnect and the external provider interface will know to match your data with that consumer's record. And then the other elements are the same: start date, start time, end date, end time, those kinds of things. It's got that authorization ID number that I mentioned a moment ago, 140787. And then it also has the note, the information that was typed in that box on the previous field. So what will happen with the external provider interface, as long as you export your data in this format, it will come in and it will actually create one of those screens like I just showed you in the consumer's record, but you didn't actually have to type it directly into APDiConnect. Again, my knowledge on XML information is limited to, well, pretty much you've just seen it. So I know that you've probably got a lot of questions about that, a lot of technical questions about that. So we do ask that if there are providers that are interested in more information about the external provider interface or want some technical specifications documents, you can use our iConnect at apdcares.org email address and send a request for that. We can send you the technical specifications documents. I've seen them. They are very technical, but I am sure that whether you've purchased or pay for an EHR service or built your own EHR service, you've got folks on hand that'll be able to understand those technical specifications documents. The other thing is coming soon will be our external provider interface e-learning video. And on our website, we have on our iConnect page, we have an e-learning library. And so one of the videos that is coming to that library will be specific to the external provider interface and will give providers information on the types of things that you need to do to configure your current EHR system to be able to export data in a way that APDiConnect can receive it. The slide that I'm showing now is just, I wanted to highlight the resources and reference material. I'm actually going to show this to you in a moment, but I just want to remind you that we have got all kinds of resources available on our iConnect page of our APD Cares website. And that information, much of it has been there for over a year now. So please check it out and check back often because we're always updating information. And then the other thing I wanted to mention is I already made reference, if you're interested in information about the external provider interface, you can use the iConnect at apdcares.org email address, but you can use that email address for any question that you have specific to APDiConnect. There are several of us that monitor that email address, and we try to get our responses back to you as quickly as possible. If we don't know the answers, we get the question forwarded to the people that do know the answers. So please use this email address, send us your questions, send us your comments. Some of it may end up being information that ends as an update on our frequently asked questions page on our iConnect site. So please use that. And then with that, what we'll do next is do what I refer to as the tour of APDiConnect. So I'm going to switch from the PowerPoint presentation and take us right into our training site so that you all can have a look. And I'm going to give the screen a chance to catch up. I apologize. I'm seeing a lag on my end. You all might be seeing the training site, but I do want to just pause for a moment to make sure everyone can see it. So this is our training site, which looks very much like our live production APDiConnect site. When you log in, and I'm logged in as an agency owner, so that's the name that I created for today's demonstration. We have, when you log in, you see my dashboard. Everybody logs in through my dashboard and sees their dashboard. You will have a default role that you're assigned when you first get your user credentials, and there'll be more at your training. When you get your individual training, there will be more information about how do you get credentialed and how do you complete the login information. But for today's purposes, we're just going to do a tour. Do want to point out that a lot of our security is tied to the role. So in this case, I am a service provider role. What that means is I am either an agency owner or a solo provider. We have other roles for our staff. If I had an employee that provided services in a consumer's record, they would have the service provider worker role. And just to demonstrate for you, you see with my service provider role, on my dashboard, I also see some additional tabs. Now, these tabs that are up here in the same line as my dashboard, they're what we refer to in APD iConnect as chapters. And so we have a consumers chapter, we have a providers chapter, incidents chapter, claims chapter, and the scheduler chapter. If I change my role to a service provider worker, it will change the view of my dashboard. And again, this will just demonstrate for you a little bit of how things change based upon the role that someone uses. So once we change role to the service provider worker, now you'll see that I don't have the providers tab. And what that means is that, again, for you as an agency owner, do all of your staff have access to your business records? Think of your provider record as your business record. The service provider worker role gives an employee access to what they need to do for their job. As a service provider worker, I'm able to go into a consumer's record and I'm able to add my service logs for the service that I provided today or my progress note. I'm able to create an incident if there was an incident. We are still configuring. The service provider worker will not see the claims tab, so I do apologize for that. Keep in mind that development configuration for the provider functionalities and all of the testing associated with that is still happening. So that's one of the configuration changes that has been identified. Service provider worker will not be able to submit claims. I do know that several of you have worked with billing agents and have asked in questions prior to this whether or not billing agents will be able to have access to the system. And yes, we do have a role. You won't see it here for my demonstration scenario, but there is a role that is specific for billing agents, and it will enable billing agents to be able to access your authorizations and submit claims on your behalf. If you have staff that work for you and their sole function is to do your claims and your billing, then they also can use that billing agent role. But I've switched back to the service provider role because I really wanted to start with giving you a tour of the provider chapter itself. But let's take a moment and talk a little bit about the dashboard itself. On My Dashboard, what you'll see is there are 4 columns: consumers, incidents, providers, and tasks. And within each one, what you see will depend upon what's waiting for you. What support coordinators see in the consumer column is very different than what a service provider sees in a service call in the consumer column. I do want to emphasize before we get too deep into the tour that in the task column, the very first panel, and we refer to each one of these little boxes as a panel, is links for information for you. For example, if you need to get to the APDiConnect help desk, this link will give you the phone number to call. And if you want to get to that e-learning library that I was talking about a moment ago, you click on that link and it will actually open another window that will take you to our website and the iConnect associated pages with our website. In our iConnect e-learning library, there are several different things that you'll find. One is our e-learning modules. These are videos. And I'm pausing because I was waiting for the display to catch up. These are our e-learning modules. These are videos. You can go and click on these. You can watch these right now, and I would recommend that you do so, especially these first 2 right here. They're going to give you the introduction to just the basics of how APDiConnect functionalities work. What's a note? What's a tickler? Terms that you're going to be hearing in your training, but it doesn't hurt to get used to them now. The overview of the Consumer Central Record is very similar to what we're going to do today, where we're going to do a little bit of a tab-by-tab review, but this will get into a little bit more detail to give you an introduction. There are some videos that are specific to what waiver support coordinators do, but you're welcome to watch those. Again, it helps you learn what the functionalities are, and watch this page because there are more coming. We definitely have videos coming for how to do your provider documentation, how to submit a claim, how to do your renewal application if you operate a licensed group home, those kinds of things. So we definitely have those in the works and they're coming. So check back here on a regular basis. We also on this page include lots of documents. What we refer to as the case management training manual. This is the manual that we used to roll out the consumer related functionalities last year. And we've added some cheat sheets and job aids, quick reference guides to help the support coordinators with the tasks that they have been completing since our launch last December. Currently, as we're preparing for rollout 2 and rollouts 3, we're already doing training with our waiver support coordinators for those financial functionalities. So we've added some additional training information for the support coordinators so that they can reference that as they prepare for rollouts 2 and 3. We also have some additional videos that are posted at the bottom. The video from today's presentation may end up here, or it also may be hosted from our GoToWebinar platform so that you can attend it as on an on-demand status. The other thing I want to point out that you're able to get to from this page is the frequently asked questions. If you check out our frequently asked questions page, we have been collecting these questions from all of our public presentations, our webinar presentations for well over a year, actually almost 2 years. And so you will see we've tried to break them down by category, and there are a lot of them. So please check here, because if it's a question you have today, it may have already been asked and the answers are already here. So please check this and check it often. The last thing I do want to point out before we jump back to our tour is if we go to the main APD iConnect page on our website, and I'm waiting for the display to catch up. If you scroll down to about the middle of our main APD iConnect page, you will see a link for the iConnect minimum system requirements. That is a document that's published by WellSky. This is absolutely critical information for you. Please go to the site today, and if you haven't done so already, click on this link to download that document and then get with your IT folks, check with your Geek Squad, whoever helps you manage your equipment. Make sure that all of your equipment that you and your staff are going to use meets the minimum system requirements. You will not be able to operate APD iConnect, not even in the training site, without it. It will also give you some information about what you need to do to configure for pop-ups or your pop-up windows, or how to set up your browser to be able to view attachments, those kinds of things. So please make sure you go to our iConnect page. If you go to our main website, it's at waivers, and then there's a link for iConnect, and get that minimum system requirements page. So let's go ahead and go back to our tour. I am pausing for the display to catch up, and I do apologize if there's a lag on your end. So again, I'm in the service provider role, which means that I am an agency owner or a solo provider. And when I go to the providers chapter, remember these tabs up here are chapters. When I go to the providers chapter, as a service provider, I will see only the provider records with which I am associated. In today's scenario, I am the owner and operator of this provider training example provider. I also, as part of that service, operate a group home. But let's just start with my main provider record. Anywhere within APD iConnect, when you see a table like this is what we refer to as the grid view, and you are able to sort and filter based on these columns. We also have advanced filters up here that you'll find on most screens as well. But within the grid view itself, everything is a hyperlink. So I can go ahead and just click on this record here, and it will open my provider record. And so when you get into your provider record, there's a few things that you'll see about your record right off the top. First, you're going to see that you've got your agency name. So this agency that I operate is called Training Example Provider. This 5-digit number right here is my provider iConnect ID. This is system generated. Whenever a provider record is added to APD iConnect, the system automatically creates that record. In time, you'll hear us talk less and less about your ABC vendor number and more about your APD iConnect provider number. Within your record, there are tabs, and the difference between the tabs here, again, these are chapters up here on this bar. The tabs within your record, think of those really similar to tabs in a file folder. So on our providers tab, this is our basic demographic information about you and your agency. This is the information that we either migrated from ABC prior to our launch last year, or if you're a new provider and have gone through the application process with us, this is the information that we've pulled off of your application. And it tells us a little bit of information about your Medicaid ID, if you're enrolled with Medicaid, those kinds of things. One of the things that we do have with APD iConnect that I think many providers will appreciate is we have a direct interface with FEMAS and FLAIR. So if you have an address change, and this will be something you'll go over in your training, but I'd like to go ahead and mention it since we have the opportunity. If you have an address change, you need to change your address with FEMAS, and FEMAS will be updating your record every day through the FEMAS interface. Likewise, if you have a change in your FLAIR address, if you provide services that are funded via non-waiver funds or IFS dollars, that would be a FLAIR related address. You'll want to make sure that you're updating that with FLAIR because again, that information, we have an automatic interface with both FEMAS and FLAIR that runs every day. So if you change your address and you come and change it in your own provider record and you didn't update it with FEMAS, tomorrow after the interface runs, it will revert back to your old address. Just something that I like to point out. Again, you'll get that information in your training, but that's one of the nice functionalities. You only need to change it in one place. You don't have to tell us, you just change it with FEMAS. Within the record, on some of these other tabs, and I'm going to go in a specific order just to give you a highlight, we have a Workers tab. The Workers tab identifies the employees that are associated with this record. So, for example, if you have a direct service employee that works for you and they are going to have access to Johnny's record to provide services for Johnny, you're probably going to be listing them here as one of your workers. That way we'll know when you get the authorization, because your authorization will be tied to this ID. In order for Johnny to be able to work with in order for your staff to be able to work with Johnny, they're going to need to be associated with this ID. So your workers will be listed here. That's something that will be done automatically through the credentialing process. And again, you'll get more information about credentialing when you do your training. But that's what the Workers tab does. It's how iConnect knows, APD iConnect knows when one person is associated with an actual provider so that all of the documentation they enter is tied to your authorizations. And then that, of course, has an impact on the claims that you submit. The Services tab is where, as you complete your waiver enrollment, that's where you'll be able to have your services added. So all of the services that you're currently authorized to provide, when you come in through whether it's wave 1, 2, or 3 in your provider record, those services will already be listed here. They should match the services that are currently showing in ABC and iBudget. In the example that I put together today, we only have one service, and I did that just for the demonstration purposes. But if I was really a behavior focused provider, I would have all of the behavior focused levels of service listed here. Our Provider ID Numbers tab, this is one of those tabs that's connected to our interface. So our FLAIR interface will put your FLAIR ID number here, and our FEMAS interface will keep your Medicaid ID updated here. So again, that's all part of the interface. You won't have to do anything about it, but you'll be able to see that they're there. Service area is how we identify where your agency is enrolled to provide services. And so as you go through provider enrollment, or if you were to expand at a later time, this is an area that would be updated by your staff in the region, your specialist liaison for provider enrollment. For today's example, I set this provider up to be a statewide provider. So it actually lists all of the regions and all of the counties and of all of the zip codes and cities. This is how APD iConnect will know to have you as a provider be available for selection on a consumer's record. For example, if a consumer lives in Alachua County, because Alachua County is one of the counties that are listed here through the region, then if they're looking for a behavior focused ResHab provider, because that's the service that I have, and I'm enrolled with Alachua County, then my agency will show up as a provider that's available for selection to that consumer. So that's what the function of that tab is. The credentials tab is where, and I didn't set this up today, but this is where you'll find information about your MedWaiver Services Agreement. So your MedWaiver Services Agreement with its effective and expiration dates will be listed here. Again, that's information that's entered by the provider enrollment staff in the region. One of the functionalities that I think you'll appreciate, I know the staff will appreciate it as well, is that we do have what we refer to as ticklers or workflow wizards that are associated with certain things. The expiration of a MedWaiver service agreement is one of those things that triggers a tickler. About 90 days before the expiration, you and your provider enrollment specialist will get a reminder that it's time for you to renew your MedWaiver services agreement. And how will your provider enrollment specialist be identified? On your record, your QA workstream worker on the providers tab, there is a field called QA workstream worker, and that is going to be your specialist liaison for provider enrollment. So staff in the regions have already been working in going in and adding their names. If I am your provider enrollment specialist, I've already gone into our live production site and added my name to your record. That way I will get any ticklers associated with your record. From a licensing and monitoring perspective, we have other ticklers that are associated with those. And so those folks will be adding their names as well, and they'll be getting the ticklers 90 days prior to the expiration of a license, for example. And again, the idea behind this kind of system automation is to help make sure that nothing slips through the cracks, because we all get very busy and we always think oh yeah, I've got more time to get to that. This will be a way to help make sure that we don't miss things. Authorizations. Remember I mentioned that once you come into APD iConnect, you'll be able to get your own authorizations. Every consumer that you had that your agency is associated with will have the authorizations listed on your authorization tab. You'll be able to see the status and when it was last updated. So that's something I think that all providers will appreciate. Again, until all of the waves come in, the support coordinators will still be providing service authorizations to the providers. But once you're in, you'll be able to access your own authorizations. One of the other things to note is that one of our changes from how we do things now to how we're going to be doing it is authorizations will be annual in APD iConnect. So instead of having to get an authorization every quarter, you will get an authorization for the year. The authorization will still spell out how the services can be delivered, so you won't be able to use them all at the beginning. It will be spelled out in the plan service in terms of how many units can you use per week, per month, per quarter, however it is that the support coordinator sets that up. But you will still have your authorization for the full year. And I think a lot of folks will appreciate that. Enrollments, this is where you'll be able to track consumers that are enrolled with you. or folks that have been referred to you. You will see this in this example, the consumer is open because this is someone that we actually have an authorization with. But in this disposition column, you will be able to see a disposition of referred, and that's how you'll know that you have a new referral and you need to make a decision as to whether or not you can meet that person's needs. You'll get into the nitty-gritty details of that when you do your training, but I just wanted to share with you that that's one of the way support coordinators and providers will be able to communicate in APD iConnect when it comes to referrals and being able to receive a referral and then respond to that. Yes, I'm interested. No, I don't think so. It also is a way for the waiver support coordinators to document choice with the consumers. They're able to say, you know, I made a referral to A, B, and C providers, and Susie met with all of them and she chose provider C. It's really going to help move things along, and I think that a lot of folks will really appreciate that. If you have a contract with APD for contracted services, that information will be listed here. And then our forms tab is where in your provider record, you'll be able to add forms that are related to you as a service provider. So just to demonstrate very quickly, these are the types of forms that you would be able to add. So we've got a provider enrollment application, an expansion request. We also have forms related to licensing for our licensed group home providers. And once you create those forms, they would show up here so that you could see them. And then the other tab that I wanted to demonstrate is our corrective action plan, or our CAP tab. You may have heard through the rumor mill that we also have developed an interface with Clarent. When Clarent goes out and does their review, and they do a PDR, they do the PDR report, and the staff in the region are notified, and they go to the portal and get the report and send you the POR, you know, the spreadsheet for the plan of remediation. That spreadsheet is going to go away. And instead, the Clarent information will interface directly with your record right in iConnect. And so what that means is that if there's any item that you need to attend to, then it will show up here on the CAP tab, which stands for Corrective Action Plan, and you'll be able to see, and again, because I was simulating data, there's things that are missing from this record because of it can only be populated by the interface. But the interface itself will be able to give you your overall score, your compliance score, all of that information. Your staff in the region will be able to review this report, and then they will also communicate directly with you in terms of how to complete your plan of remediation. So you will have, again, these grayed out fields, that's all data that comes directly from the interface from Clarent. This record will automatically be created. There may be comments from there, or staff may enter comments from there. This is the overall CAP record. The CAP ID is system generated. And then again, if there were items that need to be addressed, they will be listed on the items subpage. And so for each item that would need to be addressed, there would be one row in the grid view that shows up on the items subpage. And I'll pause for a moment and let the display catch up. So in this example, there was only one item. And again, please keep in mind that in the true interface, there would be more data that was in here. But since it's blocked by the interface, I couldn't add that. Again, grayed out fields are things that come directly from the interface with Clarent. So whatever it is that they typed into their PDR report, this will show up right here in your actual item itself. So it tells you which item needs to be addressed and the reason that it wasn't met, so it lets you know what it is you need to do. But when you think about the current plan of remediation spreadsheet and where you put your response, you're actually going to scroll down on the page and be able to type your response in right here on this same screen that the staff at the region are going to be able to to validate that they've seen it, that they concur that it's sufficient, or send it back to you if they need more information. But you will be able to type right here what your corrective action plan is and how you plan to address this. So again, think about the spreadsheet that you get currently for plan of remediation. That's going to go away, and we're going to do it all right here. And I think you'll appreciate it. I really do think you'll like that functionality. If there was any other reason that you needed to have a plan of remediation, I know that everybody strives to do the best that they can do, but it's not unheard of that maybe something happens and the region becomes aware of it, and they send you a plan of remediation for something that's not related to a clearance review. They would also be adding a CAP record on your record here and handle it the same way as if as the interface does. The other part of the clearance interface, just so you're aware, is the clearance reviewers. They also will have access to APD iConnect, so they will be able to come in and review your electronic record. For the consumers that they might also review for services that you provide, they'll be able to review those consumers' records, those kinds of things. And so when they come out to do their on-site visit with you, there may be in time, not initially, but in time, there will be less time that they actually have to spend looking at the records that you have in your office, because much of it will already be in your APD iConnect record. So when they come out for their site visit, you're going to get more quality face-to-face time with them because they won't have to review the records. And I say that in time because, as you know, looking at our own rolling schedule, not all providers will be in APD iConnect at the same time. Once you come into APD iConnect, not all of your records are going to be electronic because you'll be paper up to the point of when you transition to APD iConnect. So we've already worked with the clearance reviewers in terms of how they're going to navigate their review and what they should expect to see and when, but they will have access to your records and be able to do much of their review on the front end before they even come out to see you. And then the other one that I wanted to point out is the linked providers tab in the provider record. Some of our providers who also operate group homes, and the way that APD iConnect has been structured is that every group home has its own record, and licensing staff manage those records, whereas provider enrollment staff manage your provider record, very much like they do now on paper. So what we've done, what we've created is this ability to have a linked provider. And remember, I am the agency owner of Training Example Provider, but I also have a group home that I operate that for today's example, I've called it the Training Example Provider Linked Group Home. So I'm able to see from within my record, and so can the staff, and so can Clarent. They're able to see how many group homes you operate based upon them all being listed here. We're able to then go and look at that record by clicking on this checkbox, and we go to Tools. Oh, actually, apparently that one doesn't work for this role. But if I wanted to go into this record and take a look at it, and we do, I could either, I can just go ahead and click on it, and it will open, whoops, sorry. Let's go ahead and search it because I do want to show you a couple of things with the group home record. You can do a quick search with just part of the name, or you can do an advanced search with more advanced filters. But I'm going to go ahead and do the quick search for right now. And when I do the quick search, and I am pausing while the display catches up, when I do the quick search, remember, I see only the providers that I'm associated with. So I am going to see all of my records since I'm the agency owner. So here's my group home. My group home's provider ID is 17412. And I can go ahead and open this. And you'll see it has very much the same layout as my agency record, but the difference is the name. So this is my group homes record. This is the record that my licensing specialist works with or my residential monitor works with. And so the tabs are all the same. They have all the same functionalities. The difference is there won't be any authorizations on this record. The authorizations are tied to the parent corporation agency record. But from a licensing perspective, on the Credentials tab, you will see that my group home license record is listed there. And remember, I said a few minutes ago that we have system automation tied to that group home license record as well. So 90 days before the expiration date, and in this example, the expiration date is December 31st this year, 90 days prior to that, I'm going to get a reminder that says, hey, you need to submit your facility application for renewal. And to do that, I will navigate over to my Forms tab, and you can see just from the view how that's all done. So in our grid view on the Forms tab, you'll be able to see any form that was previously created. And the examples that I used for today are I created an initial facility application form that was submitted in November of 2017. So in our scenario today, that's when I first applied to get licensed. That's when this record was created. It was created based upon my application. I eventually got licensed, and then I had to renew last year. So in November, I submitted another application form, and instead of it being the initial, it was the annual. My monthly monitor has been able to come out, and when they come out, they do my monthly monitoring checklist. And as the service provider and the agency owner, I am able to see how my staff are doing in the group home. I'm able to see what's happening on my monthly monitoring tool. So this is where I think as agency owners, you're going to like the ability to just keep track of what's happening in all of your locations. Now let's say that there's something with your monthly monitoring that resulted in a notice of non-compliance. Where will you find that information? You're going to find it in two places. One, if you go to your Notes tab, and notes are how we communicate. They're not quite the same as email, and there is no interface. There's no automatic interface between APD iConnect and email. So once everybody's in, you'll find that you use email less. But on your Notes tab, you'll be able to see that if you had a notice of non-compliance, you're going to get a note type for monthly monitoring. It will tell you that it's about your April 2019 notice of non-compliance, and there's an attachment which will actually have the attachment attached to it. So that's one place that you'll see. If we open that note, it tells us a little bit more information. One, it tells us what CAP record we need to go and check, because this notice of non-compliance is associated with CAP ID 85. And I'm pausing for the display to catch up. This is what we refer to as a pending note. I think you guys are going to love this. When it's a pending note, you have this ability to append text to note. You can, as long as it's in pending status. So here you see I created the note this morning at 7:53 a.m. As the provider, I can type in my provider's response. And when I hit this append text to note button, it will move what I typed up into the gray box above. And I'm pausing for the display to catch up so I can highlight for you. But you will see what I just typed is now in the read-only portion of the note above, and it has a date and timestamp and a who created that additional information. We can use these pending notes as running conversation between you and your licensing specialist, your provider enrollment specialist, and this is where you would be able to respond to say, I addressed the items listed on CAP ID 85 and let them know. So that's one way of notifying them. The other thing, and I'll demonstrate this in a moment, but when you have a note recipient that's added to a note, that note, you'll get a reminder of that note on your My Dashboard. And I'll show you that in a moment. In this example, when the licensing specialist or the monthly monitor created the notice of noncompliance, they added the group home manager as the note recipient. So that person would be able to get that note on their My Dashboard. So that's how the pending note works. And I think you guys will really enjoy that. The other part where you'll be able to get information about your notice of noncompliance, because again, with a notice of noncompliance, there is a corrective action that's required. So that will also be stored on this CAP tab, where in your agency record is your QIO and your POR information. In your licensing record, any notice of noncompliance that's associated with monthly monitoring, license renewal inspections, those kinds of things, those will all be listed as CAP records as well. So if I navigate over to the CAP tab, I can see that there is a CAP ID number 85, which is what was referenced in my note. So I go ahead and I open that, and I can see that it's a notice of noncompliance type of CAP. And you'll see that the screen looks a little bit different because it's not related to a clearance review. And if I need to see what my specific deficient items were, I'm able to click on the Items tab. And the Items tab will list all of those issues that were identified during my monthly monitoring. And it will also tell me what the standard was in terms of 65G-2 of the Florida Administrative Code. And it shows me in the grid view what the due date is. So I'm able to see all of this information at a glance just by clicking on the Items tab. And then if I want to go in to each specific item and respond to that, again, with all of our grid views in APDiConnect, they're all hyperlinks. We click on them and they open. And so in this example, and I'll pause while the display catches up. So in this particular example, the grayed out boxes are the items that were completed by staff, and they're not editable by me in the service provider role. But I can see what the standard was that wasn't met, and I can see why it wasn't met. My fire drill logs weren't on site when they came out to do monthly monitoring. So what I would do is here I would just type in what my corrective action is. And much like the pending note, I would do the same append text to note button, and that will let the staff at the region know how I've responded. I think that you will all like this functionality as well. Very much like the plan of remediation process and that whole spreadsheet going away and coming into this CAP process. I think for our folks that operate group homes, that this will be a cleaner, easier way to communicate with your monthly monitor or your licensing specialist. So just wanted to highlight that functionality for you, because I know we have some residential providers who are on the call with us this morning. And the other thing that's different in the record for the group home is we do have the ability for you to list beds. And I think you'll really appreciate this. When your home gets set up, you'll be able to determine whether or not you are providing services for males, females, adults, children. And so you'll be able to set up the type of beds that you have, whether they're male or female beds, single occupancy, double occupancy, and you will also be able to identify your vacancies. So let me just open one record as an example, and then we're going to hop over to the consumer chapter so you can get a little bit of a tour of that. But when I open the APD female double occupancy bed record, I'm able to see that my current capacity is 2 and my vacancy is 1. And I'll pause while the display catches up with me. So Here we have capacity, here we have vacancy. One of the things, one of the configuration changes that we anticipate before provider wave 1 occurs is that this screen should be editable by the service provider role, because what we want you to do is if the other person moves out and now you have a vacancy of 2, we want you to be able to update this, because our vacancy report for the residential planners will actually pull from this data. So this will be where you can keep us informed as to whether or not you have vacancies. Again, right now it's showing as read only, but that's a configuration change that'll be coming. By the time you get to your training, this actually should already be editable. But I wanted to share that with you because I know right now it's handled differently in each region in terms of how providers communicate when they've got vacancies at their group homes or their foster homes. So we wanted to standardize that and then be able to run reports when someone is looking for a place to live. We want to be able to run reports to help identify the homes that will best meet their needs. The other things that we're able to identify, and in the service provider role, you don't actually see it, but we do also have the ability to identify group homes as to whether or not they're wheelchair accessible, whether or not there are other languages that are spoken in the home, those kinds of things. And so when we do run that residential planning report, we'll be able to pull all of those data elements to find the homes that would best match the needs of the person that's looking for a residential placement option. Other than that, the tabs are all the same. So let's go ahead and take a look at how the consumer chapter is laid out. One of our security features is that service providers should only see consumers that they either have an open provider selection record with or they have an authorization with. And when I say an open provider selection record, I can show you that in a moment. So let's go ahead and do a search. And so when I search for consumers, the only consumer that I get is this individual, also known as the name of example consumer. This individual is a consumer that my agency has an authorization for, which is why I'm able to access this record. I could try to look up John Doe and I won't be able to get access John Doe's record because I don't have an authorization for John Doe. In the service provider role, I see just a few of the tabs that are associated with the consumer. I really only see what I need to be able to do my job as a service provider. I've got the basic demographics. So this is the information that many of you are already keeping in the records that you keep. And so think about all of the duplication of records that we are going to do away with. We are going to do away with support coordinator maintaining the central file, information being an ABC, other information being an iBudget, and then every single provider that works with that individual is going to have their own records. We're going to do away with all of that duplication with APD iConnect, and we will be able to have all of it in one location in the consumer's record. And I think folks will really appreciate that, because if there's an update to the demographics, everybody will know. If, for example, the individual moved from one group home to another group home, everybody that works with that person will know, because we'll be able to notify them from within the record. I think that folks will really appreciate that. The diagnosis tab will have, and in this example, whoops, I apologize for that. The diagnosis tab will have the individual's diagnosis, and it will include their APD eligible diagnosis, as well as any medical or mental health diagnoses that either the provider or the support coordinator report over time. So the APD eligible diagnosis is determined by APD staff, and they're the ones that will create that record. But if, as we all go through our own aging process, we know that some folks over time, they pick up new diagnoses. And so if someone suddenly has high cholesterol, support coordinator will be able to go in and add in high cholesterol as a diagnosis so that we've got a good running history for this consumer. The medications tab is exactly what it sounds like. This is where we'll be able to add all of the medications that a consumer takes if a medication is discontinued, we'll be able to discontinue it and be able to show their true medication history. The beauty of APD iConnect is we have built in some linkage between information. So we have certain forms that will pull information directly from certain tabs. An example is the person-centered support plan. When the support coordinator does the person-centered support plan, they will be able to pull the medications that are listed directly into the person-centered support plan. Another area where we're able to pull information from one part of APD iConnect into another is the Contacts tab. The Contacts tab is what I often refer to as the circle of supports. This is where we're going to put everybody that matters for the consumer and what their relationship is. If we have a legal representative, we're going to list the legal representative. If someone has multiple relationships, for example, if they are the parent and the guardian, we'll be able to list them as the parent and the guardian. And all of that information can then be pulled just from this contact tab into the person-centered support plan or into other forms like the implementation plan. So there is that sense of enter it once and use it when you need it. That is something I think a lot of you are really, really going to appreciate. The Notes tab is where you're going to be able to communicate certain things. There are different note types, note subtypes. When you go through your training, you'll learn more about what all of the note types are, what all of the subtypes are, those kinds of things. They have a different, each one has a different purpose. But in the example that I've listed here, let's say that our consumer has gone for an annual physical and the doctor has ordered something. So as the provider, I took this consumer for their physical and we walked out with a prescription for physical therapy. Well, in today's world, you're either emailing or calling the support coordinator and saying, hey, the doctor wants this person to have physical therapy. Well, now you're able to get that documentation directly in the consumer's record. And I'm pausing while the display catches up so that you can see the note. So in this example, I, as the agency owner, I was in this consumer's record and I created this note that says to the doctor, or it says to the support coordinator, the doctor has given us a prescription for physical therapy. That happened at 8:05 this morning. Our support coordinator was up and at it already, saw the note because she was diligently working in the consumer's records in APD iConnect. And at 8:15 this morning, she responded because this is a pending note, which means it's that running conversation. She responded thanking me for this. She's going to meet with the consumer and their legal representative to make a decision about what's happening with this referral for physical therapy. So right there, we've got ongoing communication happening live in the consumer's record, and it's all being documented. Clarent is able to see your efforts to help the individual meet their needs that are recommended by their physician. Clarent is also able to see the support coordinator's efforts to support consumer choice, as well as looking at identifying and supporting needs that the physician has identified. All of that is happening in one place. So let's go ahead and close that. And then another area where you will be working as a service provider is in the Forms tab. Remember, I mentioned that in some services, if there is a service-specific form that as an agency we chose to standardize, we haven't standardized all forms, but there are some forms that are being standardized, you will be able to add that form. So from the Forms tab, you would be able to add forms, much like you do in your provider record when you want to add your application renewal, and you have a list of forms that are specific for services. So let's just go ahead and use the implementation plan as an example. And so here we have the implementation plan, and this is intended for any service that uses an implementation plan. You choose your agency's name as the program provider, and you have these different types of reviews. So we're going to say that this consumer just moved in less than 30 days ago, and this is their initial implementation plan. That's how we're going to set that. And then we're able to go through the form and complete certain elements. Some data elements are required, as you'll note by the red asterisk. A red asterisk means that it's required. But right here, I did want to demonstrate this for you when I was talking about how we're able to pull information that was entered one time into APD iConnect. We're able to pull that information into other areas of APD iConnect. The person-centered support plan, the implementation plan, they are examples of forms that have been built to do just that. So here in this section where we're looking at who are the participants in this implementation plan meeting, we're able to search existing relations. And if we search and we click on that search button, what will open for us is the list of all of the contacts that are on that consumer's contact tab. So remember when I was showing you the contact tab, we had two individuals that were showing. One was a caregiver, one was a legal representative. And now when I click on that search existing relations, I see those same two people. Well, of course, we had our legal representative at our implementation plan meeting, and it pulls all of that information directly into this form. Enter it once, use it as often as you need to. And I think that that is a functionality that is going to be a huge time saver for a lot of people. And again, you'll if anything changes, you update it in one place. So medications, same functionality. You click on search existing medications and it would pull the medications in. So this is an example of how the forms interact with different parts of APD iConnect. And you can save a form and close the form, and then what will happen, because it's been initiated, in this case it's not complete, but once you save a form, it will show up in that grid view on the Forms tab so that you can see it and come back and work on it later if you need to. So any form that's created when the support coordinator does the person-centered support plan, you'll be able to see the person-centered support plan in this grid view and those kinds of things. All of that information will be available. The Auths tab shows all of the authorizations for this consumer associated with me as the service provider. Remember, I can already see that in my service provider record, but if I want to see exactly, because when I look at the authorizations tab in my provider record, that's all of the consumers that I work with. But if I just want to be sure that I've got everything for this consumer while I'm working with them in their record, I can click on their Auths tab and see the authorizations associated with just this consumer for my agency. And then the SAN tab is exactly what it sounds like. You will be able to see when a SAN has been submitted. As the service provider, you won't get to see all of the details about the SAN, but you will be able to see a SAN was submitted on X date, and you'll be able to see when the SAN has been completed. So that's one of the things that I think will help with communication, because oftentimes we hear, I think the support coordinator submitted a SAN for that. Now you'll be able to tell for certain. Okay, so that is most of the consumer record. What I'm going to do now is change roles, and let's walk through adding provider documentation, and then we'll also look at incidents and go back to the dashboard. Before I change roles though, let's go back to the dashboard. I did want to demonstrate something. Remember when I was going through those notes, we added people as note recipients. One of the ways that you're going to be able to keep track of the things you need to do in APD iConnect is from your My Dashboard. Your My Dashboard will have lots of information that will help you organize your day as an agency owner or a solo provider. In your consumer column, you will have various different things. And again, because this record was just created and there's only one consumer, the amount of information to be seen is very limited. But in time, when you're working with, 50 or more consumers, you'll see more information in this consumer column. You'll see things like ticklers. If there is a tickler that is associated to a specific consumer, you'll have a panel that says ticklers, and you'll be able to monitor your ticklers that way. The big area where folks are going to be looking at to manage their day are their consumer notes, their consumer ticklers, their provider notes, and their provider ticklers. So in time, you'll see more information on your My Dashboard. And once we start using incidents, if there's follow-up that you need to do in the incidents column, you will see information there. So in time, this is going to be your hub of information to help you focus what you need to do. If you see in the notes column, in the consumer column, that there is a pending note, then that lets you know, one, there's something that somebody needs to respond to. Maybe it's me, maybe it's the support coordinator, but you're able to click on this link from your My Dashboard and it will open a new window for you that shows you all of those pending notes. And from those pending notes, that list of pending notes, you're able to read them without necessarily navigating into that consumer's record. So in this example here, remember, we were just in example consumer's record, and I showed you that pending note where I had told the support coordinator, the doctor has requested an assessment for physical therapy, and the support coordinator responded. When the support coordinator responded, they added me back in as a recipient so that it would show up on my dashboard. So from here, because I've already done everything I need to do for this consumer, I wasn't really planning on going back to their record today, but I see I have this new pending note. I'm able to open it, and it'll look just like it did from within the consumer's record, and I'm able to see what the support coordinator's response was. So again, because I don't have any additional documentation to add to that particular consumer's record, it's just information for me at this point. I'm able to see that the support coordinator responded, and I'm able to see that they're working on it. Nothing else that I need to do, but it was good that I checked it because I want to be sure. And then the other thing is that because I know there's nothing I need to do right now, this note will still live in the consumer's record. I just showed you that it's there. But if I want to take it off my dashboard, I can simply mark it as read from here, and then I save and close it. And what that will do is when I go back to my dashboard, you will see that the dashboard changed, and I'm going to pause and let the display catch up with me. And again, I do apologize for the delay in the display. So that little spinning of processing, that's always when APD iConnect is refreshing data. And that's how you know that whatever you've just done has been saved into APD iConnect. So I'm back on my dashboard, and you'll see now in my consumer panel, I no longer have that pending notes because I marked it as read. So one of the things that you will want to do is if you think you're done with it and you're not going to need it as a reminder anymore, and you don't want it on your My Dashboard, mark it as read. Again, if there were ticklers, and ticklers are reminders, they are things that need to be done. For example, and I'm trying to remember a good example, but I believe, for example, if someone has supported employment, I believe we have a tickler that reminds the supported employment coach to do the employment stability plan within a certain period of time. That would show up in the consumer column, and there would be a panel that it would say ticklers, and that would tell you that you've got that reminder. And some of them trigger like 10 days in advance to remind you before they're actually due. So ticklers are reminders. Providers also have ticklers. Remember, if my MedWaiver Services Agreement is set to expire in 90 days, or my group home license is set to expire in 90 days, then I will have ticklers in my provider column telling me I need to submit my application for renewal. I also will have notes here in the provider column, and we know that a pending note is a note that somebody needs to respond to, but I do want folks to know that even complete notes are for information, and you really do want to open every note that you see on your My Dashboard just to make sure that you're aware of it. So in this example, remember that notification that I had of my QIO report? This is where my provider enrollment staff, they got that interface information from Clarent. They've sent me my notification of the QIO report, and they added me as a note recipient so that it would show up on my dashboard. Just like the pending note, I can open it and it will give me information that I need. So in this example, our staff has told us that, it's CAP ID number 86 is what I need to work on to be able to address my plan of remediation. So I know this. I know that I need to go to my record and work on that. And I can go ahead, just like I did in the pending note, I can mark this note as read, and it will take it off my dashboard just by saving and closing it. There is a tickler that's associated with that particular note that specifically is to make sure that the plan of remediation. So this is an example of a workflow wizard or tickler. They're the same. When it pops up like this, we call this a workflow wizard that's quote unquote in your face. It's right there. It's a reminder that you need to make sure that this gets done. Otherwise, it shows up later, and I can show you. If I go back to my dashboard, I didn't want to cancel that because I want to show you how to find your ticklers. So when we go back to our dashboard, again, ticklers that are coming due should show up in your provider column under ticklers. But we do also have the ability to check in the task column on my dashboard, because under my management, there is a ticklers due, and we can click on that and open that. Now in this example, there's nothing showing here, but if there had been other ticklers that were coming due soon, they would be listed here as well. So again, if there had been ticklers that were due, they would be listed here, but there are none showing. Let me go ahead and switch roles because I do want to show you the provider documentation. I know that's an area where folks have a lot of questions. So again, if I have employees that work for me, then those employees would be using the service provider worker role. And that has limited role and permission. And so as an employee, there's less that I need to see. I work, I'm the group home manager. I don't own the agency. I don't coordinate all of the services that my agency provides. I am responsible for the services that are delivered in the group home that I manage. So what I see is less. So as the group home manager, I come into that consumer's record, and again, if there were more consumers that our agency had an authorization for, I would actually see a list of consumers. But for today's example, there's just this one consumer, example consumer, and what I'm going to do is go to the provider documentation tab. This is where, as service providers and employees, we're going to record all of the documentation, handbook required documentation for the services that we deliver. So from here, and you will hear your trainer say things like, file is your friend. Almost everything happens with the file menu in the top left of the screen. Depending upon what tab you're on, you may have different options at the File menu. On the Provider Documentation tab, we're going to do File, Add Provider Documentation. And this is that screen that I was showing you in the slide. This is what it looks like when you're actually creating it. So the first thing we want to do is, remember our authorization is for residential habilitation. So we're going to enter information, and I apologize if I get the type of documentation incorrect, but we're going to call it a quarterly summary. And we're going to do it today. So we'll use today's date, and it's a monthly unit, so we don't need to use start time and end time. Let's go ahead and pull up our authorization. And I'm going to pause it so that you can see when I clicked on the authorization search button, it opens a new window and it shows me the authorizations that I have for this consumer. If I had had more than one authorization, let's say, for example, if I provided residential habilitation, transportation, and companion services, let's just say that I provide those services, then on my authorization, if I click this plus button, it would show me all of the different services that I'm authorized for. That's one of the changes that will be happening from transitioning from iBudget to APD iConnect for authorizations. So not only will your authorizations be annual as opposed to quarterly, they will now also be, there will only be one authorization per provider. So if you provide multiple services to the same consumer, they will all be listed on the same authorization. Each service, each auth service will have its own PA number, but everything will be listed under that one authorization, which in this case is authorization ID 153057, but my authorized service ID is 12454. So they'll all be listed. You won't have to have multiple authorizations for consumers if you provide multiple services for them. That's one of the changes. I think you'll like that as well. So when you're going and doing your provider documentation, once you pull up the authorization, you want to be sure that you get the right service that you're doing the documentation for. You don't want to have a quarterly summary if you really meant to add your transportation log. So in our case, we only have one service. We're going to go ahead and click on, because like any of our grid views, it is a hyperlink. We're going to click on that, and that will take us back to the provider documentation screen, and it will complete many of the fields on the screen. And let me pause while it catches up. So you can see here that just by clicking on that, it has pulled in my service code, the description, the rate, the secondary code, that the unit type is month. All of that information has been pulled in. The only thing I need to do is change the unit so that it is a 1, and then I'm able to come down here and add in my documentation. So again, in my scenario, because I don't know what the required documentation is, but we're going to say it is a quarterly summary. So I click on quarterly summary, and then I click the arrow, the caret, to move it to the right, and that will let APD iConnect know that I'm doing a quarterly summary. And then in the notes box, in that note field, and we have this is a 7,000 character field. And so here is where you would type the information that you normally would type in your quarterly summary information. So you just type in quarterly summary information. And then you do File, Save, and Close. And what that does is that shows in the grid view the documentation that's been provided. So the other thing where this will help with your communication with waiver support coordinators will see all of your documentation as soon as it's completed. So, and Clarent is aware of that as well. If you tend to have a system where you already are using a Word document or a Word template for the information that you typically would put in a quarterly summary or a service log or any other type of documentation, if you wanted to type that information in another system, you can do that. You can certainly type something in a Word document, and then you can copy it and you can paste it into the notes section on that provider documentation screen. So you do have the ability to do that. Some folks prefer the formatting that may come from working with a Word document. And again, I know that there are folks that are using other systems, and we acknowledge that there's going to be a period of time where you're going to trust but verify. You're going to go ahead and you're going to put your documentation here into APD iConnect, but then you're going to still keep it somewhere else just in case. So we recognize that. You're able to go ahead, type it up in Word, and then paste it right here into this box. If that's where your comfort zone is. We do have spell check. You can spell check within APD iConnect. But again, we recognize that there are folks that for a while, they're going to want to use the system that they're comfortable with as they're learning the new system. For our folks that have more specialized documentation requirements, for example, the behavioral providers, there is actually different reports that they'll be able to create to add in the information that they need that the area behavior analysts look at in terms of monthly graphs and things like that. But that's all information that you're going to get when you get into your actual training per the rollout schedule. So as a service provider employee, as a worker, I've left that note in pending status. Why have I left it in pending status? Because my agency may have this rule, and many agencies do, that they don't want documentation to be considered complete until the supervisor has reviewed that. So let me change roles again. I'm going to show you something, another feature that I think you will really like. So I'm back in my service provider role, and now I have the provider chapter again. I'm going to go ahead and go back to my provider record. And actually, so I went on to the workers tab in my provider record, and I see that the display has paused. So let me give it a second to catch up. Still waiting for the display to catch up. So I'm on the workers tab in my linked group home record, and I see that I've got the group home manager listed and myself. I just want to demonstrate this for you because again, a lot of folks are looking at how do I keep track of what my staff do and how can I monitor their work? One of the things that you'll do is in their worker record, we have lots of information in the worker record. Much of it is not editable, but there are some things that will be editable, one of which is supervisor. So you will be able to add yourself as a supervisor. So I added myself, the agency owner, as the primary supervisor on this worker's record. So what that means is that anything that this particular employee does, I will have access to it because I'm listed as their supervisor. Some agencies are large enough that they have multiple supervisors and they want, this supervisor to monitor those 10 staff and that supervisor to monitor those 10 staff. As the agency owner, you'll be able to set that up. But then from a quality assurance perspective, what you're going to want to do is if you are an agency that has that rule that nothing is changed to completed status when it comes to the handbook required documentation, unless it's had a supervisory review, then what you will do as part of your routine business is whoever that person is that is the supervisor, they will be the ones that will then go back and check the documentation. one of the real important things to keep in mind with APD iConnect is it has a strong history table. And so if there is any change to any documentation, then the system will track who made that change, and it'll give a date and a time stamp for that. So for example, we're back in the consumer's record. I'm in the service provider role now, acting as the supervisor, and I see that there's new documentation showing impending status. I am able to open this record. I'm able to review it, make sure that it's got the right provider documentation type, make sure that we've got the right authorization and service associated with it. And I'm able to review that note field for the content to make sure that it meets the handbook requirements. If it doesn't, then I'm able to say to my employee, you need to go back and amend your note, because keep in mind, it's their documentation, but I'm able to do all of that. And then if I feel that this meets all of the handbook requirements for billing, and it meets the documentation requirements for Clarent when they come and do their review, then I will just go to the status and I will change the status to complete. When I change the status to complete, then I go to File, Save and Close Provider Documentation. And now that documentation is done, and there's nothing else that needs to be done with it. So that is how agencies are able to manage some of that quality assurance work that they want to do with their staff. The same type of thing can be done with some of the other chapters. And so let's take a moment. As soon as the display catches up, we're going to take a quick look at the incidents chapter. And again, this is something that will be included in your training when your wave of provider training comes due. So remember, today is just an overview, but I do see that we didn't get to incidents and claims. So I just want to give you a quick look at both of those, and then we will most likely wrap it up as we are just about out of time. So let's go ahead and take a look at the incidents chapter. Remember, I mentioned that you will be able to create your incident reports directly within the APD iConnect system. And so it really is, again, anything with file, you go to File, Add Incident, and that will open the incident report information for you. You'll be able to complete this information. Your staff, if they're the ones that are completing the incident report, they will be able to complete this information. One of the things that you'll be able to do is identify the support coordinator. So the support coordinators will have more up-to-date information on new incident reports, those kinds of things. And so this is a functionality that we are looking at including with our rollout 4 with the wave 1 of providers. And I won't go through how to complete it, but I just wanted to show it to you that it exists, and that then from this initial incident report information, there are additional documents that you will complete that will be part of the whole incident report. There are also forms that our staff will be completing as part of their follow-up, and it will all be right here in the incidents chapter. So let me just go ahead and save this one real quick, and it's not going to let me save. So let's call it a reportable incident. We will say it happened today at 7:30 this morning. Those are all of the required fields. I just want to demonstrate for you, rather than completing one, that once you save it, then we get additional, what we refer to as, well, there's another workflow wizard, but we don't need those right now. When you save certain records, what happens is you get what we refer to as subpages. So once an incident is created, then there are several subpages that will become available for more information. Those subpages include things like adding notes. If there's, let's say, a hospitalization and we wanted to attach the discharge papers, for example, or adding who the involved person was, those kinds of things. But also on the documentation subpage is where you would be able to add more information about that specific incident. And this will look very much like the incident report form, has the same type of information. One of the things that you will notice in APD iConnect is that there are some forms that have what we refer to as conditional logic, meaning that based upon what you answer for one question is what you get to see for as other questions. So for example, if I choose reportable, the type of reportable incident question displays, and there's a drop-down box of the various different types of reportable incidents. Let me hold on while the display catches up. So you see then once you select reportable, you get a whole new question that is specific to reportable incidents. If I were to choose critical, then my field type, my next field becomes type of critical incident, and I have a different list of drop-down options that are available. So that's what we refer to as conditional logic. It makes it so that you're able to tailor the form to exactly what it is you're reporting today without having all of those other fields that really aren't relevant to this particular situation. So I just wanted to demonstrate that functionality to you. And then quickly, we've got about 5 minutes left. Let's talk a little bit about claims. Really don't want to get too detailed into claims because that is way down the future for you. But you will have two places where you're able to submit claims. You will be able to submit claims from your My Dashboard. And we recognize that the whole claim submission process is something that is really important to our providers. We recognize that, and we want to make sure that this is something, once we roll this out for you, that it makes sense. And I think you're going to find that it's actually pretty easy, but folks are anxious about it, and we acknowledge that. I'd be anxious about it too, absolutely. But from your dashboard on the task column, and I am waiting for the display to catch up, but in the task column, there is a section, a panel called My Claims. So you can actually submit your claims from here. You can submit a single claim at a time. You can submit a batch claim, and where you submit all of the consumers claims for all of the consumers that receive the same service. You'll be able to, if you have to void or replace a claim, you're able to do that from My Dashboard. And if there's something that you need to resubmit, you're able to resubmit. If you are importing and forgive me if I get the terminology wrong, but if you are importing an 837, you're able to do that from the import option under My Files. So a lot of your claim work can actually be done from your My Dashboard, but you can also then do it from the claims chapter. And so from here, you would be able to add a new claim. I'm not going to go through that process right now because the screen is still being configured, but there are multiple places where you're able to do this work. As a service provider, you're also able to track the status of your claims. We have what we refer to as claim pre-adjudication rules, which the first thing it does is it kind of checks to make sure that the claim meets the Medicaid and the handbook requirements. And if it passes pre-adjudication, then it will get transmitted to FEMAS, where FEMAS will then do their approval or rejection of it. But you will be able to see right away when you submit the claim if it has passed the APD iConnect pre-adjudication. And then we get the response back from FEMAS and ACA pretty quickly. So you'll be able to track the overall status of that claim from right here in the claims chapter. You'll also be able, and when I say track the status, that also includes being able to see when the reimbursement has been issued. So you'll be able to see when it's fully approved and when the payment's been issued, and that will all show up right here on your claims chapter. So I know I went through incidents and claims very quickly, but again, I think when we look at what's happening with our Wave 1 Rollout 4, and all of the functionalities that we're getting into. The bulk of what you're going to be doing, again, is going to be in your consumers chapter and in your providers chapter, and organizing how you do your work every day will happen with your My Dashboard. So we really wanted to focus on those 3 tabs, those 3 chapters the most, because those are the things that are going to have the most relevance to you when you first get started into APD iConnect. I know that we had a lot of questions coming in today, and I do apologize, but we're not going to have time to get to those questions. I hope as I've been going through the tour that maybe some of those have been answered, but we will certainly take all of the questions. We will compile them into one document with responses and get that information out to all of our attendees today. And again, this has been recorded, so it will be posted. We will notify you where it's posted and when it's available for viewing. If you had employees that weren't able to join you today, then they'll be able to see it at a later time. We thank you for your time, and remember, go to our website, get those minimum system requirements, and make sure you're ready. Thanks, everybody. Have a good day.